Hello, and welcome to the Conduit Street Podcast. I'm Jack Wilson, Queen Anne's County Commissioner, representing District 1. This podcast is your connection to Maryland policy and politics, covering the issues that shape our communities and the decisions that impact everyday lives. Let's dive in.
Hello and welcome to the Conduit Street Podcast. You have a guest host with you today. Stepping in for your regular host, this is Karrington Anderson from the MACO policy team. Joining me, we have a special guest today who is a longtime advocate for public health. Today we will be discussing a topic that you do not immediately think of county governments when you hear it, but it's a broader hot topic in public policy in Annapolis, across the country, and certainly one counties care about as public employers. Joining me is Vinny DeMarco, president of Maryland Healthcare for All, and we're going to be diving into prescription drug affordability. Vinny, thanks for joining us.
Thank you, Karrington, very much. We're big fans of MACO and all the local leaders.
Great. We're very excited to have you. So before we dive into how Maryland is aiming to address drug affordability and what the General Assembly passed this legislative session, let's start with you talking about prescription drug costs and what the problem is and what we're trying to solve here.
Well, basically, the problem is that drugs don't work if people can't afford them. Drugs don't work if people can't afford them. And there are many, many Marylanders, polling shows maybe 40%, who really can't afford the drugs that they or their family members so desperately need to keep alive. Or they have to make hard, terrible choices of choosing between school for their kids, food, energy, and the drugs they need. So many people go to the drugstore with a prescription, can't pay for it, and have to leave it at the counter. And it really is horrible for people's lives and for their pocketbooks. In addition, all of us pay the price of higher health insurance premiums because our health insurers pay about a third of their premium costs as high cost drugs. And that is just terrible. And we all pay in higher premiums. And finally, local governments are stretched by the high cost of drugs. One of our heroes, Anne Arundel County Executive Stuart Pittman, talks about how they spend more in Anne Arundel County on high cost drugs than on libraries. And that's just not acceptable. And it doesn't have to be that way. We pay in America so much more than people in other countries because in other countries, there is something like a Prescription Drug Affordability Board that says we're going to put a limit on what we pay for the high-cost drugs, like is happening at the national level with the Inflation Reduction Act, President Biden's law that says Medicare can now negotiate with drug corporations, so they're not going to be gouged. Medicare is no longer going to be gouged, and we want to make sure that Marylanders and local governments are no longer gouged.
I love that quote from County Executive Stuart Pittman. Can you say that again?
Stuart Pittman says that in Anne Arundel County, local government spends more on prescription drugs for its employees than on libraries. And that is unacceptable.
That is just a really good quote, though, because it's so true. It's a great talking point. And counties, we are major public employers and major payers of health benefits. So this is definitely an issue that affects our budgets and services. And all of this feels heightened with Maryland's fiscal outlook as well. So the Maryland General Assembly did pass a bill this year, Senate Bill 357, House Bill 424, also known as the Lowering Prescription Drug Costs for All Marylanders Now Act. Can you walk us through what this legislation does and really why it's such a big deal?
Well, first of all, I want to thank our lead sponsors, Delegate Bonnie Cullison, Delegate Jen White-Holland, Senator Dawn Guile, Brian Feldman, for their leadership on this bill, which puts Maryland, great sponsors, and thank you for Governor Moore for administration support for it. He is going to sign it, which is great. This law puts Maryland at the forefront of making high-cost drugs more affordable for all Marylanders. Maryland passed the first in the nation Prescription Drug Affordability Board law in 2019. And I want to say that one of the reasons it passed is because of MACO's support. MACO's president at the time, Barry Glassman from Harford County, was one of our key leaders. And in fact, he, of course, a Republican, and Democrat Stuart Pittman did a TV ad together. And I don't think this bill would have passed in 2019 without that TV ad. So MACO played a key role in getting that law enacted. Now, when that law was enacted, the legislature wasn't ready to give the board it was going to create the authority to make high-cost drugs more affordable for everyone. They had the board make high-cost drugs more affordable for state and local governments as a kind of a first step, and then they would expand on that. It's important to note that 3 states, Colorado, Minnesota, and Washington, have since enacted PDAB authority with full authority to help everybody, which is exciting. But Maryland is now catching up to them, who caught up to us. So we're now back at the forefront with this law to make high-cost drugs more affordable for all Marylanders. Now, it's important to note that the law states that the board cannot use its authority to make high-cost drugs more affordable for everyone until it has set in place upper payment limits for at least 2 drugs for state and local governments, and that's been in place for a year. So we expect the former to happen, and I'll talk more about it in a second, this summer, and so that under this new law, in 2026 at some point, they'll have the authority to make high-cost drugs more affordable for everyone. It is a very big deal because, as I said, so many Marylanders can't afford the drugs they need. All of us pay through higher costs, individuals and state and local entities, government entities. So we are all going to benefit, taxpayers, governments, individuals, from this law.
Yeah, it's really one that absolutely touches every household.
Yes, every household, yes.
This bill, not everyone is in the weeds as we are every day during the legislative session. I think some people see an initial introduction of a bill, or sometimes people might just see the final version of a bill if they see it at all. So Senate Bill 357, or what we might call the PDAB bill, the Prescription Drug Affordability Board bill that we're talking about, it didn't pass in its original form. It looks like it had some amendments during the legislative session, which we know is very common in Annapolis. It often reflects negotiations and just feedback from stakeholders. So can you kind of walk us through how it's changed and moved through the General Assembly?
Yes. And it's very close to its original form.
Right.
And yeah, it's very close to its original form. And the basic provisions are there as the lead sponsors introduce them to give this board the authority to make high-cost drugs more affordable for everyone. The amendments, which we are all fine with, added some people to the Stakeholder Council.
Yep.
And the Stakeholder Council is a very important entity that advises the board, and it will now include people representing folks who have rare diseases, who have special interest in making sure that their access to those drugs is maintained. And also oncologists are added, and people who are patient advocates are added. And the statute now requires the board to provide more information in its reports on the impact of the upper payment limits, which is fine, and the board is up for doing that. And there's a language saying the board needs to check into the impact on people with rare diseases. These are all very important measures, changes. So we were all okay with all the changes, but the basic provisions are intact. And again, just like in 2019, yes, just like in 2019, MACO's support was critical. We appreciate your testimony in favor, which was terrific, and the local county executives.
That's right.
Stuart Pittman, Calvin Ball, Mark Elridge, Mayor Scott, all came in. President Collins from Charles County, all submitted testimony and made clear that they are very much want the law to help their government entities that they run, but they also want the law to help their constituents. That's why they supported expansion of the board's authority.
Yeah, I definitely think this is an issue that's being talked about all across the country. And with this bill, it is interesting. So you're saying that not that many, the bill's staying true to kind of the core, which I think is great. I know you also kind of fought off, and some legislators fought off some amendments because there were a lot of proposals to change things. So anything you want to touch on that?
Yeah, one of the main ways that now our opponent is Big Pharma. And first of all, we thank Big Pharma for developing these life-saving drugs. I mean, it's great that they're doing that, but drugs don't work if people can't afford them. And there's no need for this kind of big money to be made off of these drugs. The pharma folks say they need these high prices to fund research, but our research shows that they spend more on profits and advertising than on research for the drugs. So they don't need to charge these high prices. And they fight us tooth and nail all the time. They want to make these high profits, unfortunately, but we want to make sure people can afford the drugs. The way they tried to undermine this bill, and they've done this in other states, is they propose language to exempt so-called orphan drugs, drugs that are for one particular disease, but the language is such that it could be expanded to other kind of drugs very easily. And we didn't want any limits on the board's authority. The board will take into account things like shortages and needs of the people who take the drugs. So we fought very hard against attempts to limit the board's authority. And a similar effort was made in Colorado, which was defeated, and defeated here, to exempt certain drugs from the board's authority. These drugs are ones the board should look at to make them more affordable for people. So the fact of the matter is, the Maryland General Assembly looked at this issue very carefully, thought about what Stuart Pittman said about Anne Arundel County, and thought about what a woman named Erica Miller said, who she was on a drug for her DHCD, and she was having real success with a particular drug that was giving her what she called peace of mind, a quiet mind, which she called it, which I thought was very, very good way to put it. And then she got a divorce and lost her health insurance and could no longer afford the drug, had to go on another drug, which wasn't helping her as much, and lost her job. Wow. And as she testified, she lost her job because she couldn't afford her drug. So that's the kind of message that the Maryland General Assembly listened to and passed this bill.
Right. And it's something that efforts started in 2018. It's not like this was the first time this conversation has taken place, and that there wasn't stakeholder conversation and research done. It's been long conversation. It's been something that's not been a one and done effort. It's been strategic. It's been layered. It's taken years. So all of that's really exciting. And I think, again, the thoughtful negotiation and really broad support, especially with this final product. So we've talked a little bit about the Prescription Drug Affordability Board. We touched a little bit on the legislation in 2019. Can you talk a little bit more about how this bill is going to build on that foundation, and how maybe we'll be working with how this works with the PDAB board, and kind of just what that all looks like?
Yeah, the board is doing very well. First of all, the board is created with 5 members, one picked by the governor, one by the attorney general, one by the Senate president, one by the speaker, and the chair picked by the Senate president and speaker together. And they made a brilliant choice in former Health Secretary Van Mitchell, former delegate, former health secretary, a brilliant choice to be chair. He's been doing a wonderful job. And he hired a terrific guy, Dr. Andrew York, who was at the federal government, to be the executive director. With the other members of the board, they have put together a really smart policy program, which is leading to, we hope this summer, that the board will use its authority to set upper payment limits on what state and local governments pay for certain high-cost drugs. The two they're looking most closely at are Jardiance and Farxiga. There are 2 diabetes drugs.
Okay.
And the data shows that they are really budget busters and cost governments a lot of money, and lead to Stuart Pittman spending more on drugs than the libraries.
Right.
But the other interesting thing about these 2 drugs is they are also on the Inflation Reduction Act's list that there was negotiation between Medicare and the drug corporations. So those are among the first 10 drugs that Medicare negotiated with the drug corporations and set a limit, about 60% of what they were paying before.
Okay. So starting with these 2 drugs and then hoping to expand that over time.
Yeah,
Okay,
hoping to
great.
expand that over time. Yes.
And then let me stop you there too with the talking about upper payment limits. Let's kind of define what that is, and then
Okay.
what does it mean in practice for PDAB to have the authority to set upper payment limits?
Yeah.
Walk us through that.
The important thing to understand is, as a state, we can't affect the price of the drug. The federal government could, but the state can't affect the price of the drug. So we're saying, the price is what you're making it, but we're limiting what we pay for. And that's what we call the upper payment limit. And similar to what the Public Service Commission does, a limit on what we pay for on utilities. So upper payment limit is a limit on what Marylanders pay for high cost drugs. Now, in this stage one, it's state and local governments. So for these two drugs, Jardiance and Farxiga, potentially, or whatever drugs they pick, the board will say, this is the upper payment limit to what our state and local governments will pay. And it will save state and local governments millions of dollars. And next year, after 1 year, they'll be able to say, well, this is the limit on what all Marylanders pay for these drugs or whatever drugs. And I do think that over time, they will expand their authority, the upper payment limit use to other drugs. One thing I want to emphasize is that the board is doing its work systematically, carefully, with lots of input. There are pharma folks on the stakeholder council, and there are people who they hear from everybody, and they're working. It's balanced, and they're working very, very carefully. Now, there was a lawsuit in Colorado challenging the legal authority of
this was one of the things I think that we heard from some of the opposition, and maybe kind of what you're getting at. But I think what happens really with this policy is a big deal. It's a bold policy effort. So I think there always is going to be opposition. And I think one of the points of contention, which is maybe what you're getting at, was whether granting the board this kind of authority, especially the ability to set the upper payment limits, raises constitutional concerns. So can you kind of unpack those concerns, respond to them, and then talk about the lawsuit too?
Yeah. Now, for some history, in 2017, the Maryland General Assembly passed a law to regulate the price of generic drugs and authorize our Attorney General to go after generic drug companies that made unconscionable price increases. That was challenged in court, and the Federal Court of Appeals ruled that unconstitutional under the Dormant Commerce Clause, meaning that impacted interstate commerce because it affected the price, so we couldn't do it. So we regrouped, and based on that decision, came up with this upper payment limit authority. And the Attorney General has issued opinions saying that it's perfectly legal and constitutional under the Constitution, Dormant Commerce Clause, and every other way, so that because we're affecting what we pay and not the price, it doesn't have that same issue. In Colorado, where their Prescription Drug Affordability Board has the broader authority, they have not implemented it yet, but they have it. They picked a drug, Enbrel, and the manufacturer of that drug, Amgen, went to court and alleged that just talking about an upper payment limit for Enbrel was a harm to them, and they wanted the whole thing stopped. That was dismissed on standing grounds. The court said they haven't done anything to potentially hurt you, so this case is dismissed. They will probably file that suit again when the upper payment limit is actually issued, which hopefully will be later this year. Now, in Maryland, we're in a different situation right now because the first upper payment limits are for state and local governments. And the case law is pretty clear that state and local governments can choose what they want to pay. And right now, it's hard for state and local governments to do that since they don't know what a reasonable amount is.
Right.
If the drug company says you have to pay $100,000 for this drug, they don't know that that's not a fair amount. But now when the Prescription Drug Affordability Board says the fair amount is $60,000, just making up these numbers, they say, well, that's what we're going to pay. And I think any lawsuit on the state and local government authority would be dismissed right away. I mean, Odds are they'll file something, but I don't think they will get anywhere. Next year, when the board uses its authority to help everybody, it'll be a more contentious lawsuit. I still think we will succeed and we will win and it will be maintained. But I don't think there's any serious threat at all to the first step on state and local governments.
Okay. So will there have to be more legislation, or is the way that the bill was written, they can just next year start trying to expand that past state and local governments? There won't need to be another bill next year to do that?
No other bill.
Okay.
No other bill. This bill did it. And one of the things I want to emphasize is that the Maryland General Assembly thought about this carefully over the last few years. It's been an issue a couple of times. Now, the original bill 2019 envisioned that in 2023, the legislature would consider expanding authority because they were supposed to have finished the upper payment limits for state and local governments by 2023. Unfortunately, former Governor Hogan slowed that by vetoing a bill in 2020 to give the board the authority to put an assessment on drug manufacturers, insurers, and PBMs to collect the money it needs to do its work. That was overturned the following year in 2021, but that delay kept things from going forward on track. Luckily, Governor Wes Moore came in and came to the rescue, gave the board some additional money and further authority in statute in 2023. So based on Governor Moore's actions, the board is able this year, we believe, to make high-cost drugs more affordable for state and local governments. And that is enough for the legislature to have passed this broader authority, subject to, again, the board issuing upper payment limits for state and local governments, that being in place for a year, and then they can expand their authority to everybody.
That's helpful to hear. And I think just the fact that, again, that this had legal vetting, that the amendments and just redrafting of bill over time has been very purposeful. Because again, at the end of the day, this is about affordability. It's not about interfering with innovation. And I think that's, kind of what we have here. So we've talked a little bit about some of the other states. Can you talk about them a little bit more? What other states are doing this? How does Maryland compare, or how does our approach compare, or even at the federal level as well?
Well, at the state level, 3 states, Colorado,
Okay, 3.
Minnesota, and Washington,
Okay.
have passed full PDAB laws with upper payment limit authority to help everybody. None of them have implemented it yet. They're more recent than ours. Colorado is the closest. They're looking at one drug, Enbrel, and hopefully they will do an upper payment limit for that this year sometime. But we will be the first, I believe, Maryland, to use this authority this summer. Several other states have created PDAB type entities without any real authority to start being basically study organizations, most particularly Maine, Massachusetts, New Jersey, Colorado, Oregon, those states. A couple other states, one state I want to mention, Virginia, twice the legislature bipartisanly passed PDAB authority, and Governor Youngkin vetoed it twice. So we're hoping a new governor will be there, because they only have one term, each governor. So hopefully there'll be a new governor in 2026, because they have election this year, who will sign it next year. And Pennsylvania, Illinois, Michigan are also working on them. I want to give a shout out to 2 wonderful local leaders in Maryland, Stuart Pittman, of course, Van Arnold County, and Calvin Ball from Howard County, who not only played a critical role in getting our bill passed, but have, at our request, written letters to local leaders in other states.
Oh, wow.
New Jersey and Illinois in particular, a letter from them saying, we really did a lot to get our PDAB enacted here. It's working. We encourage you to get it enacted in your state. So thank you, execs Stuart Pittman and Calvin Ball, for all you're doing.
That's great. It's also really awesome to hear kind of an area where Maryland is leading. And then also, I do think this is helpful to see how this fits in the national conversation, and even how Maryland can potentially be a model for other states.
Yeah, national is important. The Inflation Reduction Act was a great law. Thank you, President Biden, Vice President Harris, for getting that enacted. And as you know, that allows Medicare for the first time to negotiate with the drug corporations so they don't get gouged at Medicare. It will save Medicare recipients money and save the federal government lots of money. And it's being implemented as we speak. And the regulations that our board created to implement the upper payment limits allows them to do something called reference pricing, which is to say they could base the upper payment limit on when some other entity has done the work and concluded should be what an upper payment limit in effect. So no, I'm not saying this is what they're going to do, but one potential for the board is for Jardiance and Farxiga that are on the CMS list to say, well, the upper payment limit that we're going to use in Maryland is the one the federal government's using for Medicare. And because it wouldn't make any sense at all for Medicare to be paying a certain amount for a drug, but Anne Arundel County and the state of Maryland to be paying a lot more for the same drug. So we hope to build on the success at the federal level.
Okay, yeah, that's really interesting. And I think, yeah, especially for counties, that predictability in drug pricing could be a game changer.
Yes.
Just with how our budgets work and really needing to have some predictability there.
Let me just...
Yeah, go ahead.
I just want to thank AFSCME for being a very strong supporter of this from the beginning and really want to make sure that the local governments aren't gouged by the governments that they negotiate with and represent their employees. So thank you, AFSCME, for that support.
Yeah, that's great. So what's next for the board? What role do you see for local governments and the advocates as this work continues?
Well, it's a good question. The next step is the board has a meeting on May 19th.
Okay.
It's a virtual meeting in which the board will think about its next step on issuing upper payment limits. And we are hoping that it happens soon, soon after May 19th. And what we want to do as advocates is to support the board in doing this and help Marylanders know about it. Make sure Marylanders know that this is happening and give their input. We had forums all across the state. We'll continue to reach out across the state because we want to have people let the board know what are the drugs that are hurting them, both individuals and state and local governments, to let the board know, here are the drugs that are really hurting us. I can't afford it. I can't put my kids through school because this drug's so expensive, or we're paying more on this than our libraries. What are the drugs? The board needs to hear from Marylanders about that. So it's a back and forth relationship. And we are also spreading the word to other states. I'm going to be traveling around to those states I mentioned, letting them know about Maryland's success. And I want to thank the Maryland Legislative Black Caucus, Delegate Janelle Wilkins, chair of that, for their incredible support this session. It was one of their top priorities, but they are also opening the doors for us to their colleagues in other states so that we can move this forward. They invited us to a presentation at the National Caucus of Black State Legislators, which was very good. And so we want to spread the word across the country and how effective this law is.
Yeah, sounds like you could be a busy conference speaker this summer.
Well, I'm hoping to get around to places, and there's a lot to say. You know, one of the criticisms that the pharma makes is that this has been around since 2019 and the board hasn't saved any money yet. Well, Governor Hogan's veto is the main reason it's taken this long, but now the board is about to save state and local governments millions of dollars. And we want to get that message out in Maryland and across the country.
It's good. And again, I think it goes back to, we know it's not a one and done effort. Again, this has started in 2018. It's strategic, it's layered, it takes time. So it's all really exciting stuff. Is there anything else that you want to say about prescription drug affordability or PDAB?
Just that folks want to know more, they could go to our website, healthcareforall.com, They can learn about this. And if you're really interested, you should go to PDAB, PDAB.maryland.gov. PDAB.maryland.gov. You could find out what the board's doing, and you could sign up to listen in on the Stakeholder Council meeting. There's actually one on April 28th. And then on May 19th is the next board meeting, and you could listen in. And I recommend that, especially the May 19th meeting will be very interesting.
That's perfect. Vinny, thanks for taking the time to chat with me and our listeners today. Congratulations on the passage of the PDAB bill. We're looking forward to continuing to work with you and really appreciate your time.
We love Mako. Thank you for everything.
Thank you. And just a quick reminder for everyone, our 2025 summer conference is quickly approaching, and it's coming up August 13th through the 16th. The theme for our conference is Funding the Future, the Evolving Role of Local Government. That is going to be at the Convention Center in Ocean City. There's going to be some really good content. We hope to see you there, maybe even have some conversations about prescription drug affordability. All right, well, that is it for us. If you enjoy hearing about local politics and policy, be sure to subscribe to the Conduit Street podcast from whatever device and service platform you choose. You can follow us on X, Facebook, and the Conduit Street blog. On behalf of Vinny DeMarco, this is Karrington Anderson. Goodbye, and we will talk to you soon.